So today we're going to dig into something pretty fascinating, a forensic review of the original Pfizer COVID-19 vaccine trial papers. Yep, these are the exact documents that were used for the emergency use authorization way back in 2020. This analysis makes some really significant claims about the data regulators saw. So let's break down what it says.
You know, it's probably the most fundamental question in all of medicine. And the answer we all rely on is a process of rigorous clinical trials and truly independent regulatory oversight. That whole system is the bedrock of our trust, and it's exactly what we're going to be putting under the microscope today.
All right, let's go back in time for a second. Picture it. It's late 2020. The world is completely gripped by the pandemic, and the pressure to get a vaccine out the door is just immense. This was all happening under Operation Warp Speed, an initiative that was literally designed for one thing: unprecedented velocity.
So, to get that kind of speed, regulators used what's called an emergency use authorization, or an EUA. Basically, it's a tool that lets unapproved medical products get out to the public during a massive emergency, especially when there aren't any other good options. The key thing to remember here is that the whole process was, by design, accelerated.
So how much time did the FDA's advisory committee, the outside experts whose job it is to review all the data, how much time did they actually get? You're looking at it. 20 days. Just 20 days to go through hundreds of thousands of pages of incredibly complex data for a brand new kind of vaccine technology.
And this timeline, wow, it really shows you just how incredibly compressed that schedule was. The data gets finalized on November 14th. Just 6 days later, the application is in. The committee meets on December 10th, and literally the very next day, the EUA is granted. It was a whirlwind. Okay, so this brings us right to the central claim of this whole forensic review. It alleges that buried inside that mountain of data, some really crucial information about the deaths of 2 trial participants was left out of the main summary that was given to that advisory committee. So what are we talking about here? What was supposedly missing? Well, the researchers who did this review point to 2 specific cases, and the key here is that both of them happened before the official data cutoff date, which means they absolutely should have been part of that primary safety review.
All right, so the first case involves a 63-year-old woman from Kansas who is in the vaccinated group. She passed away on October 19th. That's nearly a full month before the data cutoff, and according to the documents, there was an autopsy, and the cause of death was listed as sudden cardiac death.
Then there's the second case, a 58-year-old woman from Georgia, also in the vaccinated group. She died on November 7th, just 1 week before that cutoff. In this case, there was no autopsy, but the cause of death was officially noted as cardiac arrest. Now here's the kicker. According to the review, the internal documents show that the trial sites were told about both of these deaths on the very same day they happened. And that right there is the central question the analysis poses. If they knew, why was this information apparently not included in the final report that went up for the EUA? So what's the big deal? Well, the review argues that by excluding these 2 deaths, along with others it claims had reporting delays, it fundamentally changed the top-line mortality numbers that the advisory committee was looking at to make their decision. Okay, so this is what the FDA committee officially saw. This was the count. By the cutoff date, a total of 6 deaths, 2 in the vaccinated group and 4 in the placebo group. I mean, you look at that on the surface, and it suggests a pretty favorable safety profile, right? But according to this deep dive into the internal documents, which, by the way, only came out because of a court order, that wasn't the whole story, not by a long shot.
Now look at this. This is the tally that the review team put together from those very same documents for the exact same time period. It shows a total of 11 deaths, 6 in the vaccinated group and 5 in the placebo group. All of a sudden, that picture of the mortality balance between the 2 groups looks, well, a whole lot different.
So, you have to be asking, how could something like that even happen? Well, the report includes this direct quote, claiming that while they found these reporting delays for deaths in the vaccinated group, they did not see similar delays for deaths in the placebo group before the EUA was granted. So, let's zoom out a bit. The analysis didn't just stop at that initial period before the EUA. They decided to look at the full 6 months of available trial data to see if any broader patterns might be hiding in these discrepancies.
Over that full 6-month period, the review says it identified 10 sudden deaths in the vaccinated group, compared to 5 in the placebo group. That's double. But what's really interesting here is that despite the higher number of deaths, the number of autopsies performed was exactly the same for both groups, just 2 each. So what does this all add up to? Well, the final conclusion of the analysis is pretty stark. They claim that when you account for everything, all the alleged omissions and reporting delays, there was a hidden 3.7-fold increase in cardiac-related events in the vaccinated group compared to the placebo group.
Now, the implications of all this go way beyond just this one trial. The report really uses its findings to propose some major systemic reforms, arguing that big changes are needed to strengthen the whole oversight process and, frankly, to rebuild public trust.
So what are these proposed fixes? First, they say we need better data systems with real-time, transparent access. Second, we need to really strengthen the independence of these advisory committees. Third, they say we have to give independent experts full access to the raw data before a decision is made. And finally, we've got to get way better at tracking safety after a product is already on the market.
But in the end, the analysis really points its finger at the emergency approval process itself. The argument is that the intense pressure and that artificially short timeline created an environment where a truly thorough and complete review was, well, maybe compromised from the start. And that really leaves us with this one big, critical question, doesn't it? In a public health crisis, we all want solutions, and we want them fast. But this forensic review forces us to ask, when speed is the #1 priority, what's the potential cost to certainty? What's the right balance between a rapid response and rigorous oversight? It's a tension right at the very heart of modern medicine.